Good afternoon and welcome to United TV. Welcome to Bariatric Friday. My name is Kemal Erkan. We are going to have Dr. Irgau joining us for today's topic. And we are going to revisit one of the most important topics in bariatric care, the risk and complications of bariatric surgery. While benefits of the surgery are significant, life-changing, it can be even life-changing, it's critical that we understand potential risks and how to manage and avoid them. So, Dr. Irgau, thank you for joining me. And
of course.
These episodes are getting a lot of good feedback from our patients, and I know we want to make sure that we are available. And even if we are repeating some of these, there is a reason. So
Absolutely.
we want to reach out to more people and make sure that they can hear this in different words, different times, and hopefully we can make an impact in their life. So risk and complications. Now, I'm also in this business for a long time, and I would probably say I'm one of your surgical students, not on the clinical side, but just understanding the surgery, and especially on the bariatric side. So, and us running our American Surgery Center together, we have a lot of information, statistics, and I have a really good feeling about where we are, but we want to make sure patients are feeling the same. So patients are always worried about something. It may be a new procedure, it may be a new medication, side effects, this and that. So something may go wrong. And what are the most common short-term complications following the bariatric surgery?
Definitely. So I agree wholeheartedly. The issue of risks and complications of bariatric surgery is an important one. It's important because any benefit of any particular procedure is really limited or defined by the potential for complications. So we really can talk about benefits of bariatric surgery if we are able to control the complication rate to a very, very low level. Importantly, it's extremely critical that we inform our patients about the potential for risks and complications. So this is a very pertinent topic. In terms of short-term complications of bariatric surgery, in terms of the really serious ones, there are really three that stand out, right? One is the potential for bleeding, which can happen with any type of surgery, where the surgeon is essentially dividing organs, reattaching organs, and dealing with blood vessels. So the risk of bleeding is there, of course. The second potentially serious complication is the opposite of bleeding, which is formation of blood clot. And blood clot can occur in the legs and the lungs, and sometimes it can be potentially life-threatening. The third potentially serious complication in the short term is infection caused by leakage of the staple line. And just to go over these three in a little bit more detail, Kemal, when we talk about bleeding, it is something that could potentially occur very early after surgery. We're talking about the first few hours after surgery. It is something that we are very, very focused on in terms of preventing it, but also in identifying it if it's occurring so that we can take care of it in a timely fashion. Blood clots are things that can happen with any type of surgery. Surgery by itself, particularly under general anesthesia, is a risk factor for the formation of blood clots. Essentially, blood clots can form generally in the legs, and then they can travel in the lungs and interfere with breathing, and they can be potentially life-threatening. There are also other factors that can put a person at risk for blood clots, and one of them, of course, is obesity. And of course, all our patients are obese by definition because that's why we're doing bariatric surgery, which means that our patients are, from that point of view, at higher risk for blood clots than the general population when undergoing surgery. By far, the best way to take care of a complication, particularly this complication, Kemal, is to prevent it. And we have excellent means for prevention. In fact, as you know, we give all our patients blood thinning medication before surgery. For some of our patients, actually carry on taking blood thinning medication for up to 30 days after the surgery. Our patients are encouraged and helped to walk very early after surgery. It's one of the best ways to prevent complications. And of course, as you know, all our patients will have special boots when they are asleep during surgery that will help us pump the blood flow from the legs into the rest of the circulation, and that will also help us prevent blood clots. So although it's a very serious occurrence when it occurs, it's very rare because we focus on prevention, and we've been very successful with that. The third complication is the leakage from the staple line when we're dividing the stomach or the intestine. Again, we take measures also to minimize that in terms of reinforcing the staple line with a special material, but also taking some measures that will decrease the pressure inside the stomach or the intestine, which will discourage leakage. Again, it's a complication we keep an eye on. At the first sign of its occurrence, we will do tests to identify it and take care of it. So these complications can be serious. They are very rare, and if they occur, we can take care of them very safely.
So let me actually support what you said with some of the statistics. In year 2024, the number of leaks is only 2, bleeding is only 1, and the blood clot is 0. This is 2024, and we did probably 370 cases that year. And so far this year, the only among these three, only 1 bleeding that we have in the first 6 months. Now, I'm actually able to check this directly from our database, and also one of the reasons this is readily available is because we have to monitor all these because we are reporting them as part of our accreditation to the MBSA QIP, and that's why these are also publicly available. Now, we talk about the short-term complications, but many complications emerge months or years after the surgery. So what are the long-term complications patients should be aware of?
So long-term complications are complications that can occur up to a long period of time after surgery. The short-term complications I mentioned earlier are really pertinent for the first few weeks after surgery. Some of them first few hours, like the bleeding. But the next ones that we're going to talk about are the long-term complications. So we're talking about months to years after the surgery. Well, nutritional deficiencies are prominent here because, as you know, when we do bariatric surgery, we're actually interfering with the body's ability to digest and absorb nutrients, right? Because we want to decrease the amount of calories that the person is taking. But by doing that, also we are interfering with the body's ability to take in essential nutrients like vitamins and other micronutrients. And we have to really educate our patients and give them the appropriate tools for them to be able to avoid that by taking, for instance, vitamins or extra vitamins after the surgery, by having them monitor their vitamin level by doing blood tests on a regular basis so that we can really tackle this earlier on. Now, these nutritional deficiencies, obviously, very often, if they occur, are caught early and addressed appropriately, whether it's vitamin D deficiency, iron deficiency, anemia, occasionally B12 deficiency or folate deficiency or B1 deficiency can be identified as well. Of course, if these deficiencies are allowed to go to extreme levels, they can be very serious. Some of them can lead to weakening of the bone, hair loss, or even nerve damage can occur. So when we really emphasize to our patients the importance of really staying on course with their vitamin intake, it's because we have in mind these potential complications, and this is the best way to avoid them. There are other potential complications of the surgery that we do. Dumping syndrome is one of them, for instance. Dumping syndrome is really a series of different symptoms that patients can experience, from abdominal pain, bloating, nausea, vomiting, diarrhea, or even passing out, particularly after a procedure like gastric bypass. And that can occur if a patient actually eats anything that is refined sugar. When refined sugar enters or is dumped into the intestine directly because of the new connections, those symptoms can occur. And patients who've experienced that will tell you they will never touch a piece of chocolate or ice cream after that because those symptoms can be serious. Now, that is a complication that can occur, obviously, as a result of the change in the anatomy of gastric bypass. And some of people may look at it as a curse because they would love to have some sweets from time to time. Other people could look at it as a blessing because getting away from sweets was probably a very important goal
Right.
for them in terms of improving their lifestyle.
Sure.
Other long-term complications can be things like bowel blockage, and this can happen particularly after gastric bypass. Ulcer formation, again after gastric bypass, particularly if the patient is a smoker. That's why smoking is a big no-no after
Right.
bariatric surgery. Or if they're taking medications like aspirin or Motrin, which are known as NSAIDs. And patients who had gastric bypass who take these medications in a regular manner, they can develop ulcers. And ulcers can be potentially serious problems as well.
Right.
I've mentioned mainly the complications that can occur with gastric bypass, but if we look at the sleeve, probably the more relevant potential long-term complication is heartburn or acid reflux. Not in everybody, but it can happen with the sleeve gastrectomy. That is correct.
Now, going into the prevention and mitigation strategies, prevention is extremely important to reduce both short and long-term complications. How do we minimize the risk of complications both before and after surgery with the prevention?
So preventing complications is really a very major part of what we do when we prepare patients for surgery. So as I said, when we look at these major potentially serious complications, and you mentioned how low these potential complications are in our practice. And the reason they are low, Kemal, is because prevention is part of what we do on a routine basis, right? So all patients, for instance, as I said before they undergo anesthesia for bariatric surgery, they will have an injection of something called Lovenox, which is a blood thinning medication. All patients will be getting up and walking. Excuse me.
Bless you.
Excuse me. Walking very early after surgery. That's another way to prevent complications as well. In terms of leaks, I talked about reinforcement of the staple line. Again, excuse me.
When you are coughing, I'm going to just help with this. So one of the things with the immediate medical care and that team, what they're able to do, that's kind of like another really important point, because we do mention that time to time, but every time we focus on prevention, we're kind of focusing on patients and what we do prior time. But most of the complications are happening right after the surgery, and the team who's taking care of the patient, how knowledgeable they are on bariatric cases, and if this is their specialty. Now, I just want to elaborate that a little bit. Think about it this way. So if you are in a big hospital, let's say if you do 25 bariatric surgeries a month, the big hospital is doing the same number, and a little bit less than us. And they have 20 different ORs. We have 2 ORs for the sleeve. And they have more nurses, but they're not specialized in bariatric. Our nurses are mainly seeing bariatric cases. Therefore, that's one of the reasons that we go through the certified bariatric nurse path to make sure that not only they are just knowledgeable, but they're also getting their certification to validate their knowledge. So that has a lot to do with also with the prevention, because they know what may be going wrong. Patient may not even realize.
Absolutely.
But they may see this right away because they know that they have seen this so many times before, and there are certain things that they have to repeat. Therefore, I just want to make sure that our nurses are also getting enough credit from the prevention, because they do a really outstanding job.
Yeah. Absolutely. Yeah, as you mentioned, it's the team is all focused on the patient's safety, essentially. And there are protocols in place that every patient will be having implemented on for us to make sure that there is safety. So if, for instance, let's say there is a procedure which is not a common bariatric procedure, but maybe a revision type of procedure that we don't do very commonly. and if the risks and benefits of the blood thinning medications are such that the surgeon decides not to give the blood thinning medication, the nurses will question that. They will say, hey, doctor,
Right.
we don't see an order for Lovenox today. How come? Which means that everybody is tuned essentially to make sure that all the protocols that we have for safety, for preventing complications are in place. And it's no surprise that our complication rates are very, very low.
Right.
Now, in terms of other potential complications, for instance, we talked about nutritional deficiencies in the long term. There is a reason why patients undergo through 3 nutritional encounters before surgery, right? Because
Right.
we want these issues to be hammered in terms of education for patients to really buy into the importance of this, because ultimately they will be responsible for taking the vitamins. They will be responsible for choosing healthy foods that have good micronutrients. But unless they understand the importance of this, obviously they may not be as committed. But it is our job to make them understand that, to educate them. And that's why we have extensive preparation for patients to understand how critical it is to make sure they have the adequate vitamin.
That's kind of like with patient education you are emphasizing. So I have a kind of related but unrelated issue that I'm going to run this by you. So is it true that the best time for us to eat dessert, not just for bariatric, like like me, you, Ethan, not when we are hungry, not on an empty stomach, but on a full stomach? Is that
Absolutely, makes
okay?
sense. Yeah,
So
absolutely.
we are saying that it's better to eat the dessert on a full stomach, meaning after dinner. If you are going to have a cup of ice cream or whatever you are having, it's better if you don't. But if you have to, do it after you are full.
Absolutely.
And the reason for that is,
Well, the reason for that is, first of all, you don't want most of your meal to be the dessert, essentially. If you're taking something when you are hungry, you are more likely to eat more of it than not, right? And then secondly, you don't want that big spike in blood sugar and also in insulin that occurs with that big meal that
so
occurs.
how the
right?
glucose is being processed, right?
Absolutely, absolutely.
Because if that's happening, and then if the body is responding to this when it's on an empty stomach, so then it's going to take the max out of that sugar.
Absolutely.
Then therefore, it's going to waste that very quickly. The numbers are going to be going crazy, and then 2 hours later, we are going to be crashing
Absolutely.
because we need more of that.
Absolutely.
So
absolutely.
this is a patient education.
Yeah.
Now, I know this from our sessions or some of the other health-related things that I'm watching, but this is important. So it needs to be. It's also important that it needs to come from a verified, licensed channels like ours.
Absolutely.
So once patient knows this, now going to the bariatric, we want to make sure that they follow what they learn, what instructions they are given. So part of the prevention is going to come from, yes, we can give everything and anything, but if it's not being followed and understood, then we would have issues.
Absolutely.
Now, let's go to the enhanced recovery after surgery.
Yeah.
I kind of lean into that a little bit, but how the enhanced recovery protocol help with the complication rates?
Tremendously. So one of the major improvements with the ERAS protocol is to get patients to be up and about early after surgery, right? And that has many, many advantages in terms of preventing complications, but also enhancing the recovery. In the past, as you know, particularly when patients would be in the hospital for 2, 3, or longer days after surgery, patients' pain medication would be a response to their pain. They have pain, you give them pain medication. Well, first of all, by the time the patient complains of pain, they're already in a lot of suffering, right?
Right.
And the response comes after that. So the nurse has to go get the pain medication, administer the pain medication. Already the pain level is very high, right? It's heightened. In addition, the pain medication we used to use was basically narcotics. So the patient is in pain, you give them narcotics. Yes, you get rid of the pain, but also you subdue the patient. Mentally, they become much more sleepy, right? So they are less likely to be up and about.
Right.
In addition, their digestive tract also goes to sleep when they get this medication. So All this leads to a very vicious cycle that will prolong recovery but enhance potential complications. And why is that? Well, because the more pain medication you give, the less the patient will walk, the less they will walk and stay in bed, the more likely it is that they could get a blood clot, for instance. But also, the
Right.
whole idea of having so much pain will terrorize the patients that they will not move at all, right? So we switched that completely around by getting them medications and preparation that will allow them to have very little discomfort without the use of narcotic medication early after surgery. That's why we're able to do surgery in an outpatient setting. These big surgeries that when I was training would have been unthinkable for people to go in a surgery center to have.
But
And
now
yet,
it's the safest
with the,
places.
it's the safest place. With this preparation, it's actually the best place. We selected patients to have the surgery. So we prime patients, for instance, with medications that will decrease the transmission of pain. Even before surgery, we give them these medications, right? During surgery, we strategically identify nerves that carry pain from the abdominal wall where the incisions are, so that when patients wake up, they have no pain. I always tell you about how when I was in training, one of the things I dreaded all the time was seeing the patient wake up from anesthesia. They will have this big frown because they're feeling the pain, and we have to give them medications to put them back in a sleepy situation, right? But in this setting, actually, you see patients waking up with a smile after anesthesia, which means that as soon as the anesthesia wears off, you can get them to walk. And once patients are in an upright position, they don't play the sick role anymore. They don't feel obliged to be, oh, I am sick, I have to be in bed, everybody else has to care for me. No, they don't feel that way. They feel, I'm recovered, I am standing vertical, I am walking by myself. That's how the brain thinks.
It's all there.
So
yeah.
the recovery itself is enhanced. But the other very critical thing, Kemal, that we have observed is that if you control the pain so well early, then pain that comes later is much better handled the patients with much less pain medication. If you have a lot of pain at the beginning, then you dread the idea of having pain again, and you want to take as much pain medication as possible so that that doesn't happen again.
Right.
So that initial experience of waking up pain-free or with very little pain primes the patient to deal with the pain that may come later in a much better way. That is why the vast majority of our patients, if you ask, they will tell you they will take pain medication maybe for a day, for 2 at the most. And these are non-narcotic pain medications that will keep their head clear, that they will not interfere with their digestive tract in terms of recovery. So that's why it's called enhanced recovery after surgery, essentially. And we've implemented it really well in our center, with most patients really getting the best out of it.
So I probably mentioned this before, but my dentist, Dr. Radio, she did a lot of work on, well, in my mouth, I guess.
Yep.
So a lot. And she's been with me for, I would say, since 2003, 2004.
Wow.
And because I have some crowns, so they were on a second round. So, and one of the things that we established from the get-go is I was never going to have any pain when I was there. And I never had.
Amazing.
So,
Yeah.
Dr. Radio really did a great job where it just took the fear of going to a dentist. In fact, it's kind of like, it's now for me, it's kind of fun to go there because I know she's also, I would consider her as a friend. So we share, dog pictures and videos and catch up with what's happening. So nothing about pain. And then I'll give you another example where I'm not going to mention her name, but one of my dermatologists, remember that injection that we had for the, is it PRP for the hair?
Oh, yes.
PRP,
Yeah.
right?
Yeah. Yeah.
So because she was doing it during my meetings with her, and because she just didn't care, and I remember how painful it was.
Oh, yeah.
And there's no one in the world can force me to go to a PRP treatment for my hair. Never, ever.
Yeah.
Because all I remember is the huge pain.
Pain, yeah.
So I think the psychological connection to these and what that reminds of, or like the way that pain is communicated in the body. Because I know we talk about this in different ways for different reasons. Where before something happens, we need to take care of that so that something doesn't become too big. So once we have to get into that, I'm already having the pain at the high level, then everything that we are going to do is going to be extreme and unnecessary, and it's going to take us away from our focus. Now, speaking of psychological, surgery may impact the mental health, and we may uncover or worsen some prior conditions. So what psychological or behavioral risk exists after bariatric surgery?
So they do exist. After surgery, patients may have recurrence of problems that they may have before, like depression or anxiety, for a number of reasons. And depression and anxiety tend to be very high in terms of their prevalence among our patients for a number of reasons again. That is why all our patients undergo behavioral assessment and evaluation before surgery. And this is really aimed at uncovering problems that may require more attention, right? And these problems are likely to occur if they are not identified early and appropriately addressed. Because with the changes that occur after bariatric surgery, they could be issues of self-image, they could be issues of relationships, or there could be issues about handling stress without, for instance, going for food, right? Which used to be a way of dealing for stress for many patients. Now they cannot use food because they cannot eat as much as they did. Right. And we don't want them to switch that to some other ways of dealing with stress, like alcohol, for instance, which would be disastrous. So these are real problems, and we are keenly aware of them. That's why all our patients undergo psychological evaluation and assessment beforehand, so that if we uncover problems that are not already being taken care of, we can send them to appropriate specialists for that to occur. We do have support groups that are geared really to supporting patients before and after surgery. Support group settings are actually very good in this sense, because they give patients a sense of comfort and confidence to open up about issues that they may have, but also a sense of comfort in knowing that others also are going through the same problems, and then understanding methods for dealing with them. In addition, we're there for our patients to come and talk to us. Remember, there is no professionally intimate relationship than that between a doctor and the patient, right? Because and that is important, and it's important for the doctor to be available to listen in a non-judgmental way through the troubles or challenges that the patients may be going through, either before or after surgery. And because we've been doing bariatric surgery now for almost a quarter of a century now, we have learned really from the many patients that we've been privileged to take care of over all these years.
Yep. So my last question for today's session, Dr. Irgau, is about the weight regain after surgery. And we know that long-term success depends on maintaining lifestyle changes. So what percentage of the patients experience weight regain, and how do we manage that?
Yeah. When we say weight regain, it's important to qualify that. We're talking about significant weight gain, so that if a patient had lost, over 50% of their excess weight, and they regain more than 50% of their excess weight, they're going back to close to where they were. That's about 15% of patients. Very often, I think that I see that occurring really, I'm talking about our patient population mainly. I see that occurring even years afterwards if patients suddenly are faced with a challenge in their life. It could be divorce, it could be losing a job, it could be losing a loved one, which takes really the focus away from them, and they fall back into all the habits that really can make them regain weight. Now, it is very important for people to understand that bariatric surgery, no matter how powerful it is it's still a tool. It's still a tool. And it's possible for a person who's determined to defeat it to defeat bariatric surgery, right? It is possible. We're not claiming that bariatric surgery is a fail-proof procedure that nobody can have problems with. People can regain weight. Fortunately, the number of patients who have significant weight gain is much, much less than any other intervention available, whether it's medication or others. So what is important here is for us to be there when the patients struggle with that as well, right? It is not shameful to regain weight because we're all human. We can struggle. And it really points out to the chronicity of this disease, right? When people understand how serious and very, very chronic obesity is, and then it is, understandable that weight regain can occur. Just like when a person has a certain type of cancer, they've been free from it for many years, that cancer can recur again. It's a disease, it's a chronic disease. Granted, there are very important ways for minimizing weight regain, staying focused, making sure that the changes that were adopted after surgery are implemented for the rest of one's life, whether it's eating in a healthy way, whether it's being active physically. These are lifelong habits that we want patients to adopt. These are really the best ways to prevent weight regain. But also follow-up with us is important. Yes, we want patients to come and see us to celebrate their successes, and they're very proud, and we're very proud of them as well. But also we don't want them to feel ashamed when they struggle, because we're non-judgmental. We're there to support and help. It's our job to help them in their most difficult times.
Getting that help in a timely manner is important.
Absolutely important. It's far easier to address a weight regain of 15 pounds than one of 50 pounds. It's very clear here. So we want patients to really know we are their home when it comes to difficulties, and we will do everything with them to support them so that they can get back to a healthy weight.
Absolutely. Well, today's conversation underscores that bariatric surgery is not just one-time fix. It's a lifelong journey.
Yep.
The good news is that with proper preparation, education, and follow-up, and most complications can be avoided or managed effectively. Thank you, Dr. Irgau, for joining us and for your support and insight and guidance for our patients. And thank you for our viewers to watch us and joining us for Bariatric Friday events. So until next Friday, please stay united. Bye-bye.
Stay united. Thank you.